Back now, Sunday House Call on the doctors, and there's some new surgical options for women. Some physicians saying that robotic-assisted surgery offers a number of advantages for patients. Dr. Samadi, you've got a lot of experience in this. What's going on to help women in terms of surgery?
Eric, this is a very exciting time in medicine. Besides the technology, we've done obviously this robotic surgery for prostate cancer, and that worked really well. 11, 12 years ago when I was in Paris and we started doing robotic surgery, you never thought that you would sit here and the patient is about 10 feet away, and as you move your hands here, the instruments move inside the patient's abdomen. That was like a really eye-opening experience when I was doing my training. Today we see that robotic surgery is coming in for women. So all the hysterectomies, removal of the uterus for cancer, myomas or fibroids, which causes a lot of pelvic pain and difficult menses. All of this is being done now with a robot. The reason why robotic technology works for this, or Da Vinci surgery, is because we're working in a very narrow pelvic space.
We're looking at it right now.
That's exactly
there you are.
right.
You're behind the mask, someplace.
Those are my nurses. Those are my lovely team that are always stand behind me. I'm sitting at a distance away. But of course, you need to have a team. And the reason why this works is because you can visualize things better. There's no incision. There's no blood loss.
No incision?
There are basically tiny little holes that we enter and put the instruments, but there's no cut, Jamie. So they get to go home early. They get back to work. And since there's no blood, unlike open surgery, you can really see the field, and that's why certainly in my field with prostate cancer, you can see the nerves, you can see the outcome, and as far as sexual function and continence, and now we see for women this works really well.
Wow. Is there really somebody under there, huh?
Yes, there's a patient.
They wouldn't fake it. What's next?
You should make a visit, Eric.
Jamie, the key thing is, how do I decide as an internist that I'm going to send somebody for a robotic procedure? And by the way, David has helped train some of the people in this country that are doing it for women as well. It's because he's an expert in robotics. The answer is, strangely, when they studied it for women, hysterectomies or myomyectomies, when you take out fibroids, they found that it can have a longer time in the operating room and it can be more expensive. You know why that is? Because not everyone doing it has David's training, has done 4,000 cases. So if you're a patient looking to see if you have this procedure, which has obvious advantages, higher magnification, you can get to places you couldn't get to otherwise, quicker healing time, you get out of the hospital faster, you don't have that big wound.
Less bleeding.
No bleeding. I didn't see any bleeding in his OR.
Unbelievable.
When would you do it, though? You got to have someone who's an artist that has the experience, that knows what they're doing, that's done the number of cases, and has great results.
Well, what do you do? Well, if you go to the doctor, what should I ask the doctor about a surgery to do this?
Well, you first ask whether it's necessary to do it that way, and then you ask, do you know someone, Doc, who has a ton of experience, and how do I prove that?
Experience matters, and I think that if somebody can use their hands, what we used to say tactile feedback or touch is the way to go. As we did in open surgery years ago, if you can translate your experience and now bring the technology and combine them, Eric, that's when you have the magic. So the question that you should be asking your doctor, what is your experience? How many cases do you do?
What's the right number of how many cases?
I think it's case dependent. I think for prostate cancer, you should do hundreds or thousands. You want to go to the most experienced guy, someone who performs the entire case himself. If your surgeon is going from room to room and he's only there for part of the operation, that's not the good operating room to be with. Find out what the complications are. Do you have a technique? And what are the side effects? Everyone that does, for example, robotic prostate surgery may have different type of techniques and so on. So I think it's really experience of the surgeon that matters.
And washing
your hands. There
no, can I ask one last question on this before we go? Could this be used for brain surgery, ultimately robotics, because of the bloodless surgery?
Yes, it
Really?
will go on to other modalities, but right now, because there's not a lot of room in the pelvic area for prostate, for uterus, this works really well. You have full range of motion with a robot. You can really bring the camera. Look, when we used to do open surgery, you can't put your head under the pelvic bone to see. Now you can really see beautiful, and that's why men and women out there would benefit from the advantage of this.
That was Dr. Samadi washing his hands over there.
No, we're glad to know that he does that.
Thank you, Mark.
All right.